Good morning, everyone. Thanks, Dr. Kopecki, for leading off our talk today. So I'm here to talk about heart-healthy diet. I'm going to have a lot of the same components that Dr. Kopecki talked about and mention the Mediterranean as well. I have no disclosures. So we're going to review the health benefits of whole food plant-based eating just briefly, since Dr. Kopecki has done such a great job of that. We want to discuss the key components of heart-healthy eating patterns. And lastly, I want to give you some strategies to help patients modify their eating patterns to a more heart-healthy pattern. So research is starting to look at the overall quality of food patterns versus single nutrients. I think this was mentioned yesterday by Dr. Hensrud, to really look at the synergistic and cumulative benefits of patterns of eating. And again, as Dr. Kopecki alluded to, we eat patterns, we eat foods. It's a whole plate of food. It's not just one component of it that we really need to be looking at. So food patterns can be defined as the amounts, proportions, combinations, or varieties for the consumption of different foods and beverages and the frequency with which they are usually consumed. Again, this approach, I think, helps make it applicable to our patients because this is looking at the what we're eating, the how much we're eating, and the how often that they're eating foods. And really, when I want, as a dietitian, want to help make it enjoyable yet sustainable changes in their eating patterns. And I think it's that sustainability that is key for that long-term health. Dr. Kopecki alluded to this, but with whole food plant-based eating patterns, we really are seeing lots of benefits, not only in cardiovascular disease and blood pressure, but also with obesity, body mass index, waist circumference, body fat, and then some of those also how they relate to diabetes. So my first question for you is which of the following diets would represent a heart-healthy eating pattern? Mediterranean, DASH, portfolio, vegetarian, or all of the above? All right, very good, all of the above. And I'm going to highlight some of these and talk about what they have in common. All right, so this is the 2020 Dietary Guidelines, shows these as what's recommended for a heart-healthy eating pattern. It's been alluded to in several other presentations about key components. So a heart-healthy eating pattern is going to emphasize vegetables of all kinds, fruits, mostly whole fruit, whole grains, beans, lentils, olive oil, and nuts, fish and shellfish as probably the preferred animal source of protein. On the flip side, and probably no surprise, and here's maybe a picture of that ultra-processed food that Dr. Kopecki was alluding to, but it's going to be that red and processed meats, fast food, full-fat dairy products, tropical oils, which would include that coconut and palm oils, refined carbohydrates and sugar-sweetened beverages, and high-sodium foods as well. And these would be foods we want to limit in our patterns. So whole food plant-based dietary approaches, again, is a style of cooking and eating that's going to focus on whole foods. It's not maybe necessarily exclusively limited to them, but if animal products are used, they're going to be in not the main focus of the meal, and they're going to be in much smaller quantities than what the typical American would consume.